All right. Welcome to the PRH video series on the mental health impact of COVID-19. I'm joined by Katie Hryniewicz. She is a pediatrician at Palouse Peds, goes by Dr. Katie, and she's the medical staff president. And we're very grateful to have you on. So thank you for doing the interview.
Yeah, thanks for having me.
Absolutely. Our focus today is going to be talking about COVID and all things kind of pediatrician focused. Dr. Katie's kind of insights and thoughts about just the things from her point of view as an expert that are relevant at this point in time. So broadly, just to open it up, what would you say is a pediatrician or your role in this kind of pandemic?
Yeah, so I think this has evolved over time. You know, the last 6 weeks I think has felt like 5 years in terms of maybe the first week or two in particular. Every day felt like we learned 500 new things.
Man, yeah.
And from the very start, we've been focused and asked to really change the way our practice works. From the standpoint of we trying to keep everybody home following stay at home, stay safe kind of orders, and in general, just keeping kids and families safe and healthy. So we have been doing a lot of things that actually made it so that we were starting to feel a little bit like, okay, we don't have many kids coming through the office. We don't have many sick kids. Kids are out of school. I started feeling like kind of what is my role as a pediatrician in this pandemic.
Getting a little loose. Yeah.
Yep. So I gave a lot of thought to that. And what I really came up with is pediatricians have always been, since the beginning of time, what we do is we do vaccines and we do preventive health, and we are public health warriors. That's what we do. That's our thing. And so I have beefed up a little bit what I'm doing in terms of extending outreach to families in different ways outside of our clinic. I have an Instagram that I run myself. That's realtalk.Dr. Katie, which is mostly pediatric focused stuff, but also some mom stuff and pediatrician mom stuff and things like that. And I've done some COVID posts and things related to families and kids on there. And then I've also really kind of taken up doing things through our office Facebook page so that we're keeping everybody kind of up to date on COVID related stuff and whatnot.
I'll make sure and post those in when I edit this too, so we have a nice little link at the bottom for people.
Good, perfect. And then we as an office have really put a rush on getting our telemedicine stuff set up so that we can really have outreach to families through telemedicine while still keeping you at home, while being able to have you triage your needs through somebody being able to still call your doctor, talk to us, see me face to face, let me take a peek at your kid over the phone or over telemedicine like this and figure out if we really do need to see them in the office or what we need to do. And so I think we have picked up a lot of different things that we weren't always doing quite as robustly to be able to really put things out there to families from a public health standpoint.
So have you been seeing a lot of like look at this kind of thing, or like kind of a novel way of doing your reviews and stuff?
Yeah, and this is not always the best. The video quality is not always the best, and so we do lots of, okay, now text me some pictures of that rash so that I can see them up close with better quality and whatnot. I've met more dogs in the last few weeks than we met dogs, cats. I've seen a lot of ceiling fans in houses. I've seen favorite toys in kids' rooms. So it's actually been kind of fun because I get to see kids and families in their natural environment a little bit.
Oh yeah.
So it's been interesting. I think it's a new experience for everybody figuring this out. But
it makes sense. I mean, as much as there's probably some awkward things that come through, that there's an opportunity to see things there in their niche that you wouldn't otherwise get.
Yep.
I've heard from colleagues, the horror stories about I have one colleague who's doing her residency at the VA in LA, and they have a group, DBT group they're doing all through Zoom. And one of the gentlemen came out of the shower and was naked and didn't realize, and they had to cue him and shut the group down. And Zoom's bringing it all out these days. So
yes. But weird world at the moment.
But really, I mean, what I hear you saying a lot is being flexible and reaching out and making it work.
And
Yeah.
the one thing we don't want is we don't want families to feel like we've abandoned them. Even if we're trying to keep families home and out of the office when we can, we are still here for all the things that we are normally here for. And I think if anything, we are more available to them, in ways that we weren't available to them before.
Hmm.
So
And that
yeah.
makes me wonder, that we hear a lot about how COVID and the stay-at-home stuff has been really holding back patients from their providers. But what you just said kind of spoke to, I got a sense about kind of you feeling held back from being able to work with your patients.
Yeah.
Has that been difficult?
I think it has been. As pediatricians, we always, we put a lot of value on well child care and preventive
Mhm.
care, and we feel like there's a lot of value to that. Um, and that's been one thing that we had to really even limit the well children we were having come through the office and tell people that we were going to push those out a little bit. And even that just hurts my pediatrician heart a little bit to even indicate that those are not essential right this moment, because I think they
Yeah.
are essential. They just, had to wait a little bit while we were preparing things and getting things in
Mhm.
line.
So, overall, and taking into consideration, obviously, the COVID-19 context, what are the specific things that you might kind of caution or think, the things that you think people should be aware of, the how things this is going to be impacting parents, kids, but the big strokes, I mean, the big things that are kind of important to you from your point of view?
Yeah. So I think that has also evolved a significant amount over the last 6 weeks. I think from the start we were so new into this virus that we really didn't have a lot of data on, is this making kids sick? Is this making are kids spreading this? Are they symptomatic? Are they getting seriously ill? And I think we are learning more and more that kids are not particularly getting seriously ill. And so my worries and my things that keep me up at night have
Yeah.
shifted a little bit, to some of the collateral stuff that can happen with just the amount of changing and things that we have done over the last 6 weeks. One of the biggest things is just, I think there's a huge parental burden that some of these changes have put on parents.
Mhm.
I think we're already a society who functions very much within our own kind of family units. We have single family homes. We have homes with two working parents. We don't have a lot of, grandparents living in homes and things like
Mhm.
that keep us connected and give you a lot of extra help with kids and those kind of roles.
Yeah.
And I think now we have kids at home, and we have parents at home, or trying to work from home or figure that out. And, you have parents that are expected to keep up work productivity at 100% while also being their kids' Zoom manager and making sure they're getting educated and they're showing up to their 5 different things and getting their homework turned in. You
Mhm.
have teachers missing in this picture. And so parents are playing a lot of roles that they're not used to playing.
That's a
And
good
I think
point.
people are just spread really thin on top of the just being this is all very stressful and new and
Mhm.
unprecedented times. I think working within roles that you're not used to be, in charge of
Yeah.
is tricky. And I think that that has worried me a lot, just about the mental health of
Mhm.
parents and families having to manage wearing a lot of different hats that they're not used to.
Yeah, and burnout is what I hear you saying, and that, clinically,
Yeah.
that's demoralization, and that's a real
Yep.
thing. Mhm.
Yeah.
Have you seen much of that in your practice as far as presentation goes and what you're talking with people about?
When I'm doing telemedicine visits and some well visits and stuff with families, I certainly have families who are feeling you know antsy and frustrated, and I think some kids do better with having their parents school them at home than others, and some do not. I worry particularly about some of our families with special needs kids who have IEPs and all kinds of things, and I
Mhm.
know that the school districts are trying very hard to keep working with those kids in all the capacities that they're used to, but that those things are really hard on families. And so that's what I've been hearing most is this is just really is really hard. I mean,
Mhm.
doing your own work while having a toddler climb on you and trying to manage your second graders class Zoom meeting is
Yeah.
it's 3 full-time roles at once.
Mhm. And the novelty of the whole situation too. I mean, like you said, different hats, different roles, different day-to-day structures, and it's just a lot of newness that's prolonged for people to be dealing with.
Yeah,
And like you're saying, on both sides of it, it's taking a toll on you on the provider side too. And so it's kind of that sense that everybody's in it together too.
yeah.
Um, I wanted to ask you too. So when you do meet with folks, and I know as we're kind of ramping up to potentially phase open in certain ways, but the dynamic that you have with your patients, has that changed at all with this? Like, do you notice any new nuance to the way you interact now that it's kind of precious, so to speak, when you do?
I don't know. That's a good question.
I've
Yeah,
talked with yeah, I've heard from people about there can be this, and maybe this is earlier on, but there's this you know, like you come in for things that are really important, and when you do, it's like you know you don't have that sense that you have access to, because as a pediatrician, the families that work with you, they obviously care about you a lot and you matter a
yeah.
lot. And so when you've been kind of held back a while, I was just curious if you've noticed like it seems like there's any difference to people's kind of engagement or investment or just
Yeah.
gratitude even.
I think maybe I think maybe there's a little more gratitude. There's a lot more of people saying, hey, thanks for seeing us today, or thanks for being here. I think initially, particularly really early on, I was getting a decent amount of when I'd get a phone call, because our office, we take all of our own phone calls overnight. And so it
Mhm.
goes right to my cell phone. And I was getting a lot more than I'm used to of, I'm so sorry to bother you with
Oh yeah.
this kind of
Mhm.
things. Because I think, they have a lot of awareness of that we're doing a lot of different things and we're working on all kinds of different things in the office, and they felt like we were busy. And so I was having to do a lot of reassuring families that no, we're still here, like you're not bothering me, this is what I'm here for. And so I've definitely seen more of that, both in phone calls and in the office.
And it really speaks to the relationship that you establish with your patients, the intimacy of it, and the in person stuff. I mean, the even that alone, the impact that's having that people can't be in the room with you. That causes a in fact, on that note, you kind of mentioned telehealth, but what's that been like? I mean, as far as the impact to your practice and patients, you talked about how there's been some silver linings to it. You get to see people in the moment, but yeah, any other thoughts about telehealth in general and kind of how that factors in these days?
Yeah, I mean, I think there's, families have a decent amount of options out there, good or bad. Many of their insurance companies offer telehealth options. There are lots of different telehealth and teletexting and all kinds of things out there. Um, I think the fact that we are getting it up and rolling is ultimately a good thing. I think we are doing more telehealth that I would rather be seeing in the office than I'd
Mhm.
like, and I think at baseline that we will continue doing. But I think there's a significant amount of these that we will continue to be able to offer. Um, Particularly for some of our behavioral health follow-ups and things for families who come from sometimes a very long ways away and have to
Yeah.
come follow up every 3 months or less. Though those families have been really appreciative about being able to, sit and have this conversation with me, and not have to drive 2 hours to do it. And so I think it's going to be a good thing that we are going to have that option, because I think having that option be through your own primary care doctor who knows you and knows your medical history and
Mhm.
everything else is really important. And I think um, you know the fact that we have that available will make it so that families may be able to utilize that more.
Mhm. Yeah, I mean, like you're saying, Zoom, this kind of telemedicine, it's not a replacement. It's not ideal versus being in the room, but it still
Yeah,
keeps you connected. And especially in a place like Pullman or just in general, when you have an intimate relationship with your patients, it matters that the genuine dynamic you've established, especially as a pediatrician, I would imagine. I mean, you're with the kid and the family developmentally. You're a part of their
yeah,
life. Um,
yeah. And
so
their siblings, and their kind of the family dynamic. And so I think that makes a huge difference. Even families will say, well, we saw urgent care or we saw somewhere else for this like one minor thing. But I think sometimes even for minor things, the fact that you have that rapport with them
mhm,
is helpful. Even if you're talking about something simple like, do we want to do antibiotics for this ear infection or not, or do we want to watch them wait, or do we want to whatever. Me knowing their dynamics and their typical preferences and whatnot really can frame that conversation. And
mhm.
you may not have that with the provider who doesn't know you, which, you know,
That's a
it
great
makes a
point.
difference.
Yep, that's a really good point. I mean, it also brings to mind just how it can also help with efficiency. I mean, you can focus on the real stuff because you can skip some of the nuance and the learning the dynamic in the room as you go, and like them.
Yeah.
and so you can really focus on what needs to get done.
Yeah.
Um, well, I know we've been talking your ear off here, and we're really grateful for you to be doing the interview. Before we wrap, I've asked everybody this, but if you're comfortable, how has COVID impacted you personally, you and your family?
Yeah. So I it's an excellent question. Like I said, my role has flipped and flopped and all kinds of things in the last 6 weeks. With my involvement in the hospital, I've been in lots of meetings and
Mm,
coming up with protocols and plans and changing things and talking about testing and things that are sometimes would have normally been outside of my role, out in the clinic network.
mm-hmm.
So that has affected me in a way that it's been a lot more roles for me than I'm used
A lot
to
of
too,
hats, like you were saying. Yeah.
and a lot more stress than I'm used to. And so that comes home to my family as much as I don't want it to come home to my
Mhm.
family, but they have seen me definitely more spread thin and stressed out than I normally am. Um, even just the thought of, could I bring something home to my family? When will it be safe for me to hug my dad who is,
Yeah.
older and high risk? All of those things are kind of an emotional weight that this,
Mm-hmm.
and I know that many of my colleagues have that same, emotional weight, and many people out there do as well.
Mm-hmm.
So it's all had an effect on me. I think the biggest thing that I can say about myself and to all the other, parents and families out there is just giving yourself a lot of grace,
Mm-hmm.
because I think we're all spread thin and we're working with minimal bandwidth is what I like to say.
That's good.
Very minimal leftover bandwidth, and so you
Mm-hmm.
know nothing is going to be perfect. You're not going to be your as you're not going to be the same as your kid's teacher. Sometimes your kids are going to watch more screen time than normal. Those kind of things are going to happen, and I think
Mm-hmm.
giving yourself a lot of grace, and that's what I am trying to do for myself, although that doesn't always happen.
Well, and I'm glad you're sharing that because I mean, your job, you're putting yourself in harm's way on purpose. I mean,
Yeah,
that's the role you play as a healthcare provider. So it's going to take its toll. And as you know, this is an area of increased focus is the effect on the provider side of things.
yeah,
So it's real. And so thank you for sharing that.
yeah.
Yeah, well, we're very grateful for this, and thank you for participating in this interview. It's been really helpful, and I think that what you shared is going to be helpful for a lot of people.
I hope so. Thank you guys for having me.
Oh yeah, thanks, Katie. All right,
Yeah.
take care.